Welcome to As We Get Older. I'm Laura Ornduff, and I want to look at if you are a patient in the hospital or if you are supporting a patient in the hospital. Who are all of those people who go in and out of your room literally 24/7? They're just in and out all the time. They walk in, they mumble who they are, they mumble the title, and expect you to know what they're doing. If you have never worked in a hospital, that can be overwhelming and potentially terrifying. So, what I want to do is I want to look at who some of these people are. Now, I'm not going to spend I'm not going to do a 30-minute video explaining who every single person works in the hospital. I'm not going to do that. I'm going to break it up to a few short videos and focus on different areas. Like this video, I want to focus on the doctors. Now, I want to stress loudly what I talk about in this video may or may not be exactly what happens in your hospitals. All hospitals work differently. They all do. But hopefully I will give you some general information that you'll have a basic understanding. The titles may be slightly different, the functionality may be slightly different, but the whole thing is you'll have at least that base knowledge. Now, I want to stress, if you ever have questions, stop the person talking and just say, tell me again who you are. Tell me again, what do you do? And if they rattle off a title, just say, but what does that mean? Help me. Because these are people in healthcare. They want to help you. They want to help you get better. They want to help you. So ask questions, ask away. A couple terms I'm going to use: physician, obviously doctor, but the next one is a physician assistant. Now, a PA, physician assistant, is someone who can diagnose, they can prescribe medication, but they work in conjunction with the doctor. Now, Dad had a lot of illnesses. We saw a lot of specialists. I never saw a difference in the level of care between the doctor and the PA. I mean, everybody was absolutely phenomenal. So it was great. So, but just when I mention those, I just want you to be aware of the differences. Now, many people enter the hospital through the emergency room. ED, ER, emergency department, whatever your hospital calls it. When you are in the emergency room, you will be working with an emergency physician. They are focused on assessing why you are there. Where do you need to go next? Can they fix you, send you home? Can they fix you a little bit, send you to another doctor? Do we need to send you to the inpatient world? Do they need to transfer you to another hospital? Let's say you need a higher level of care. That's what they're trying to quickly assess. They work with you, again, typically only while you're in the emergency room. So if you are moved to the inpatient world, typically they will not follow your care. You may see them in the cafeteria, you may see them in the parking lot, but they're not going to follow your care of treatment, typically. Now, in the emergency room, depending on why you are there, you may interact with a specialist, surgeon, something like that. Let's say, if you have chest pains, a cardiologist, a broken hip, orthopedic surgeon, potential stroke, neurologist. Those folks, if you are put inpatient, will follow your care. They will work with you when you get to the room. They will be there with you long term. But the ED is only there while you're in the emergency room. So you've got the ED physician, you've got the specialist, surgeons. Next thing, when you're in the room, if you are admitted inpatient, you will meet the hospitalist. Again, that's a general term. I don't know if your hospital uses that, but I want you to think of that person as your general doctor. They are looking at your whole care. They're talking to your specialist. They're talking about, let's say you have diabetes. They're looking at, did the diabetes team work with you? Are there food, did the dietitians recommend certain food? They're looking at, rehab. They're looking at all of the whole healthcare team and coming up with a plan of action, because their goal is to get you better if it's possible. Get you well, get you better, and then prepare you for discharge. That's their whole focus. Now, another physician that you may or may not meet, depending on, again, your needs, is palliative care. Now, Those folks are really there to focus on kind of giving you comfort. Can they alleviate your suffering a little bit? And many times people think of it as like a terminal thing. No, it could be if you have, again, a broken hip, a broken elbow. How can they help you physically? And then how can they help you, emotionally? You may not, let's say that you're right-handed and you've broken your elbow. And how are you going to adjust using things with your left hand? They're trying to help you with the comfort. So they're looking at, there any illness that's terminal, it's curable, it's temporary, it's long-term. They're looking at how to help you. They will constantly check on your comprehension of the situation. Because again, the hospital, you are sometimes getting some powerful drugs. You may understand one day, but you may not fully understand the next day. Or as you're coming off some of the medication they may have given you for surgery, you may be kind of like, wait, what's going on? And so they're constantly working with you. Now, in my situation with mom, just because it was such a fast growing illness, that they kept checking on me. And I'm like, I'm fine, I'm fine. But they were also checking on the family. They were checking on me, seeing how I was doing. Now, to add to the confusion of all these, and again, you may run into other doctors, you may work with other doctors. That's kind of the general. But to add to the confusion, the hospitalist, you're not going to have just one hospitalist the whole time you're there. You may. Now, depend on when you came in. If they're working 5 days and you're there for 3 days and you happen to come in, you may have the same hospitalist. But you're working with the team. So if you have surgery, the next day you may work with the PA. Then you may see the surgeon. Then you may see a different PA. If you have the hospitalist, you may see 3 or 4 different hospitalists. And that's where it gets a little confusing. Now, a lot of hospitals, not all, but hopefully your hospital has in each room a whiteboard. And you can Google that. You can see kind of what's on whiteboards. Just literally type hospital whiteboard. And it typically is going to have, who's your nurse, who's your CNA, all things we'll cover in other videos. Who's your doctor, who's your surgeon. They'll have all that information. What questions does the family have? Again, Google hospital whiteboard, and you'll see different samples of that. But that's a nice thing that it'll put there, like who's your doctor, who's your hospitalist. So when they walk in, and if let's say Dr. Smith were your hospitalist yesterday, and this is Dr. Jones, she'll erase it and she'll put her name up. But again, if you are not sure who they are, what they do, they ramble off stuff, ask. Do not hesitate to ask. If you are supporting the hospital patient and you're not sure, ask. Just say, hey, I'm sorry, it's been a long night. What does this mean? And I'll be honest, I've worked in a hospital for 25 years, and there were a few people I interacted with Dad, and I was like, what do you do? Because I didn't know. So don't hesitate to ask. So hopefully this video has given you some base knowledge. Again, if you have more questions, talk to your doctor. Say, hey, what happens in the hospital in our town? What are some things here? How can I get my information to you? Ask those questions. If you're really uncomfortable, maybe call the chaplains, talk to the chaplains, but we'll talk about those in another video. But the whole thing is just ask questions. Don't hesitate to ask questions. So hopefully I've given you some things to think about. Hopefully you've liked this video. Again, explore my other videos, the ones that talk about the other positions in the hospital. And if you like what you see, if you'll hit the subscribe button, that'd be great. And I will see you in the next video.